British medical experts, from surgeons to nurses, have gathered to discuss both the moral and ethical and medical issues facing fertility methods for the future. They're all members of the British Fertility Society, and their annual conference covered key issues including national guidelines, medical and psychological care of patients, and the ethical concerns and regulation of future embryology research. The experts gathered in Cheltenham in Gloucestershire for the chance to debate and discuss issues of concerns. And medical experts say the UK Health Service recognising infertility is a step in the right direction. A major debate surrounding fertility treatment is the ethics of embryo research. Its supporters say it could lead to other treatments for major illnesses. Because of the growth in fertility treatment, the UK's nursing profession want national guidelines for the profession. For those dealing with the psychological trauma of infertility, building teamwork knowledge is crucial. Cancer Research UK claims more young people, especially in Britain, eager to get suntans, are running an increased risk of skin cancer. It believes 70% of 16 to 24-year-olds want a tan on a holiday, despite warnings of overexposure to the sun. And they've launched a program to warn of the cancerous dangers of the sun to young people. For 16 years sunbathing each summer, nurse Anne-Marie Tiernan ignored the warnings before being diagnosed with a malignant melanoma. She says she was probably aware in the back of her mind, but just didn't take it seriously enough. Now, with $400,000 of government backing, SunSmart aims to make the young aware of the dangers of the sun. They say the main damage is done in those early years up to the age of 20. It's felt that if sensible precautions are taken, people can still enjoy being in the sun while reducing the risk of getting skin cancer. Every year, 3 million adults and children die from preventable diseases because they haven't been immunised. Members of the Global Alliance for Vaccines and Immunisation from around the world have gathered in London to discuss how to expand the reach of their program. To them, it's a moral issue. The key problems remain hepatitis B, tetanus, diphtheria and polio, and how to get immunisation to the poorest people in the world. The fund aims to set up health systems in developing nations, with immunisation a key step towards better overall healthcare. Queen Rania of Jordan supports the fund and believes immunisation is a human right that isn't being achieved. The $1 billion raised in efforts to broaden its immunisation program over the next few years will help reduce the numbers of preventable deaths. One in 4 Europeans will suffer some form of mental illness during their lives. Yet the stigma surrounding mental health and the difficulty in getting help means many people are not getting the treatment they need. The World Health Organization has launched a global campaign to highlight the public misconceptions that lead to discrimination and social exclusion for those suffering from mental illness. With costs increasing for health systems Europe-wide, the World Health Organization says governments need to ensure better mental health treatment is available through community-based initiatives and better training of healthcare workers. The WHO says the stigmatization of people with mental health problems denies them basic human rights, isolates them from friends and families, and encourages discrimination at work. In the larger Western European cities, at least 50% of homeless people have psychiatric problems and cannot get the right kind of help. Public figures are being encouraged to speak out about their own past problems. The Special Assessment Clinic in Cardiff University's Department of Optometry and Vision Sciences is the only one of its kind in Britain, catering specifically for patients with special needs. Students spend a lot of time in this purpose-built clinic, which is open to the public as well as children and adults with special needs. Conventional eye tests can be testing and traumatic for those with learning difficulties. And Dr. Margaret Woodhouse and her team have developed tests specifically for those who can't read letter charts or communicate readily. It makes the whole process less stressful, and patients come from all over the country. A team of highly skilled staff are investigating the underlying causes and treatment of extreme short-sightedness in children with special needs. The centre has had some spectacular success stories. Dr. Ruth Stewart remembers the case of a little girl with cerebral palsy whose life was transformed by a visit to the clinic. This clinic is just one example of how university research, funded by private and public money, can be of practical benefit to both students and the community alike. Two-year-old Thomas Johansson still has scars on his feet from scalding hot water and will do for some time. His mother was distracted for just a few minutes. Thomas climbed into the bath and his sister turned on the hot water tap. He received severe burns to his feet and to date has received 4 skin grafts. His mother, Karen, blames herself for her son's trauma. And it's an all too familiar story. Across Britain, some 112,000 people a year go to accident and emergency units with burns and scalds. The message is that cups of hot tea and coffee can still burn a young child 15 minutes after being poured. Baths should never be filled with scalding hot water. And the kitchen is a minefield of potential accidents for the unwary parent. At the moment, there are 10 preschool-aged victims each day. Some victims can be saved from long-term scarring by immediate first aid, but the best treatment, as this campaign drives home, is prevention. An estimated 9 million people across Britain have a hearing problem, but only 1 million wear hearing aids. People often fail to notice gradual loss of hearing, and they're also put off by the lack of affordable quality aids, or by their appearance, and by the lack of follow-up care. The Songbird aims to change all that. It's a tiny high-tech aid designed to be thrown away after 6 weeks and costs only £22 a month. Specialists like Professor Brian Moore say it's a high-quality product that rivals expensive traditional aids. "60-year-old Margaret Fells has had hearing problems for many years now. National Health Service hearing aids didn't work for her. And with state-of-the-art conventional aids costing about £1,500 sterling, she suffered in silence. Having a Songbird fitted has made an enormous difference to Margaret's life. She says she's participating in life again, rather than being a bystander. Customers can purchase a hearing aid on the spot, says Martin Pettifer, Director of Hearing Care at Boots. You just come in and leave just over an hour later, having had a professional, thorough hearing assessment and having been fitted with a product, if appropriate of course, that will utterly transform the quality of hearing and indeed your life. For Margaret Fells and her husband Keith, the new revolutionary hearing aid has done just that. Scientists in Britain think they may have discovered why smokers look older than people who do not smoke. It's no secret that smoking ages your skin. Smokers have paler complexions, their skin looks thicker, and it's thought that for every 10 years of smoking, the face ages by 14 years. By the time they reach their 40s, smokers have facial wrinkles similar to those of non-smokers in their 60s. Now though, scientists at St Thomas's and other hospitals in London have found out why. Skin specialist Professor Young and his team have been investigating the effects of sunlight on skin by exposing groups of volunteers to ultraviolet light. When the team examined the results of their tests, they discovered that some volunteers had unusual amounts of a gene responsible for a skin enzyme that breaks down the skin's elasticity. It was previously thought that smokers appeared to age faster because chemicals in cigarettes increase the body's production of damaging chemicals. This new finding suggests a much more fundamental change in the skin's structure and appearance. Once this gene is activated, the protein is manufactured by the cells, and that protein has a specific task of breaking down collagen. Collagen accounts for about 70% of the skin and gives the skin its mechanical elastic properties. Professor Young says one would assume that if this collagen breaking down enzyme is active, it's causing the degradation or breakdown of collagen. The skin loses its elasticity and becomes wrinkled. With the pinch of a syringe, the microchip is inserted under the skin. The procedure takes less than 20 minutes and requires no stitches. The VeriChip, no bigger than a grain of rice, could revolutionize the way doctors access patient information. The dormant chip contains no medical records, but doctors get access to a security code, and they can use the code to access a database that holds the patient's medical information, including allergies and prior treatment. The electronic database, not the chip, would be updated after each visit. But privacy advocates fear the technology could undermine confidentiality or be used to track a patient's movements. Applied Digital Solutions acknowledge the technology could be used for other purposes, including security. Critics say that to protect patient privacy, the devices should reveal only vital medical information such as blood type and allergies. The microchips have already been implanted in over 1 million pets. Baby swapping accidents are sometimes discovered years later with disastrous emotional and legal consequences. Breastfeeding the wrong baby can also lead to the transmission of deadly viruses such as HIV and hepatitis. Exhausted new mothers and overworked hospital staff can be an unfortunate combination. And the traditional bracelet system of identification used for patients in hospital can have specific problems when used on small newborn babies. Obstetrician Chris Price recognized one problem: identification bracelets slipping off babies' arms. He designed a simple solution called NurseRight. A non-permanent matching transfer is placed on both mother and baby, thus giving the mother an easy way to check that the baby is indeed hers. The beauty of the system, according to Price, is that it involves the mother directly in the baby identification process. The tattoos come in various easy-to-recognize designs and last for about 5 days, with each design being used only once across any given admissions period. Price admits the NurseRight system isn't infallible and sees it more as complementary to, rather than as a replacement for, existing identification systems. It's been dubbed the morning after treatment for HIV, and it uses the powerful mixture of toxic drugs given to people with AIDS. The emergency treatment is now being offered to anyone who believes they may have put themselves at risk from contracting HIV. Patients include people whose condom broke, or people who had unprotected sex with someone they didn't know was HIV. Patients who believe they have been at risk from contracting HIV in the previous 72 hours are put on a cocktail of triple therapy AIDS drugs for 28 days. Previous studies on healthcare professionals show that the treatment to reduce the chance of HIV infection by 80%, but it's only recently that the triple therapy has been offered to the general public. The cocktail is only effective in preventing the HIV from spreading through the body for the first 3 days after the risky event occurred. That's because the HIV virus starts in white blood cells, where it remains for 72 hours before replicating and moving to the rest of the body. Once it moves beyond white blood cells, there is no chance of beating the virus. While enthusiastic about the treatment, doctors are worried that it may be seen as a replacement for safe sex. Three times a week, 60-year-old David Hose exercises at this cardiac rehabilitation center in Winchester, Virginia. He struggles to get through a modest workout, something which just over a year ago would have been a breeze. Hose contracted inhalation anthrax while handling mail for the State Department in Sterling, Virginia. After a few days of flu-like symptoms, Hose began coughing up blood and was driven to the emergency room. They sent him home with Cipro and some cough syrup. By the next morning, when his test showed positive for anthrax, Hose was gravely ill and lingered near death for days. Anthrax bacteria releases deadly toxins that attack tissue throughout the body, killing cells and causing fluids to accumulate. Death often occurs after delirium, seizures, and coma. After inhaling the anthrax, his body transported the bacteria to the lymph nodes. Still, he suffers from asthma, shortness of breath, and chronic fatigue. Because of ongoing illness, neither Hose nor the other inhalation anthrax survivors have been able to return to work. This lingering condition has baffled health officials. Pecора's theory about the benefits of laughter has spread to the world of medicine. Some doctors have also adopted the practice of making their patients laugh, basing themselves on the theory that joy and laughter boost the immune system. They dress up as clowns and perform for patients in the ICU. According to the American Medical Association, laughter seems to induce a relaxation response in the part of the nervous system that controls involuntary functions of the body.